welcome to my channel. Nurse Catherine here, and today I will be explaining to you all how to organize your day on a medical surgical floor. Okay, so let's get started. On my unit, we work 12-hour shifts, so it's always from 7 to 7:30, regardless if it's 7:30 a.m. or 7 a.m. to 7:30 p.m. or 7 p.m. to 7:30 a.m. That's round the clock. We all do 7 to 7:30. We're allowed to clock in at 6:53. So from 6:53 to 7 o'clock, more so 7:05, you have that time to look up your 4, 5, 6 patients that you will have for the day. After that, we do bedside shift report with the prior nurse. Okay, so now you're done with your bedside shift report. You already had the basic knowledge that the prior nurse gave you about what's going on with your 4, 5, 6 patients. From here, go back to your computer, look up the active orders that the patient has, look up their 9 o'clock meds, even the 7:30 meds if they're diabetic and need insulin. You're gonna wanna look up all of that stuff to be able to plan out your day. So from here, how do you determine which patient you're going to see first in the morning? Well, ask yourself, was there anyone overnight who had critical vital signs? Did they have a fever? Did they have hypotension issues? Did they have hypertension issues? Were they on telemetry and had an irregular rhythm? Those are the people you want to see first, even if they are the ones who are sleeping. Go into those rooms because they probably are your most critical patient. So what if you don't have a critical patient or someone who needs to be seen first? Then just go to whoever's awake. I always go to that person first because I know they're not going to get mad at me if I wake them up in the morning. I don't always base it off of who has a 7:30 med like insulin, because if that person sleeps until 9 o'clock, that 7:30 med is not going to be given at 7:30. It's going to be given probably around 10 o'clock once they get their breakfast in front of them. So now you determined who you're going to see first. Next, go into the room, introduce yourself again, ask them, I'm going to be pulling your medications. Is there a drink that I can get for you that you like to take with your medications? So then they know it's coming. They know you're coming in to work with them. So go into the room first, let them know that what you're going to be doing, and then you can go pull the medications, get the drink that they would like, and then enter into the room again. So now you have all your patient medications with you. You are going to grab your Dynamap. We call it a Dynamap. It takes the blood pressure, the temperature, the pulse ox, and the pulse, and it stores it on this little cart on wheels, and we can send it right to the computer system. So grab that, grab whatever tools you need to do a full head-to-toe assessment. So now, of course, you're going to wash your hands, use your hand sanitizer, walk into the room. From there, I like to start with all of my vital signs first. I just like to get that out of the way because they might have some blood pressure medications. So this is just what I found works easier for me. So I took my blood pressure, I took the temperature, I took the pulse ox, I have the respiratory rate, I asked them if they had any pain. That's done, it's all out of the way. Next, I step over to the computer and I go over all their medications with them. I make sure they know what each medication is for and how they will be taking that medication. If they don't know what it's for, explain it to them, educate them about their medications. They have the right to know what every medication is. Always remember your patient rights. Is it the right patient? Is it the right time? Is it the right dose? Is it the right route? Is it the right frequency? They have the right to refuse. And is it for the right reason? So always remember that before you give any patient their medications. So I line all of my medications up as they look on my MAR, and I go through each one with them. Next, I ask the patient, of course, for their name and birthday, and then I scan their bracelet. Then I go right back to my computer, and I already went over all the medications with them. So then I take my time out and I double check the medications again. From there, I can continue on to scan each and every single medication. I time out again and think, okay, so this is the right patient and all of these medications are correct. Do they align with their vital signs? Are these medications okay to be giving to this patient? And if they are, I give them all to the patient. From there, they're done. From there, I do my head-to-toe assessment. I always start up and go all the way down. That's how we learned it in nursing school, and that's what I found is easiest. But that is also how we have to chart in our charting system in Epic. It always starts at the head and goes all the way down to the toes. So I just follow how it is in our charting. So typically I like to take about 15 to 20 minutes per room in the morning to get my vital signs done for the patient, their medications, and all of my charting done in the room. Chart in your rooms if it is possible. It'll make your time go so much better. You'll be able to manage your time so much better. So chart in the rooms. Plus, the patients want to see you more. They want to see you caring for them. They don't want you in and out like that. They want to be with you. It gets lonely in the hospital for them. They're sitting there by themselves, sometimes with family, sometimes not. But they want to be able to see you there working for them and helping to improve their health. So you're done with your first patient. Now you just go to the next room, and then the next room, and then the next room. Try to keep it about 15 to 20 minutes per room in the morning, because you only have a certain amount of time to get all your medications done. So we have from 8 a.m. to 10 a.m. to get all of our medications done on all 5 or 6 patients, sometimes 4 patients. But if you spend 45 minutes in each room in the morning, you're never going to get all of that work done in that amount of time. We have always planned to do our charting, our meds, and our vitals all between 8 and 10 on our unit. That's what we strive to do. That gives us time at 11 o'clock to go to lunch or at 12 o'clock to go to lunch. So what happens if you do spend 45 minutes with a patient in the morning? It's no big deal. It happens. It happened to me just about a couple days ago. I was in a room for 45 minutes. It was the first room I went into in the morning. I was in there from 8 a.m. to 8:45, and I still had 4 patients I needed to see. Sometimes that will happen. You can't plan your day minute by minute. That is not at all how nursing works. So if you are very structured and you have to have your day planned out minute by minute, you're going to have to work through that. That is not how nursing is. You have to be very flexible, and a lot of things will jump out at you. Yes, it sounds easy to go room to room to room, but think about it. Somebody is going to have to go to the bathroom. One of your patients will. And then somebody probably will in another section at the same time, so then you don't have your nurse aide anymore. You're going to have to swing back and go to the other room to take that person to the bathroom. So you just have to be super flexible and don't get stressed out when you are falling a little behind. So that's really about it for planning your day. Of course, you're going to have your admissions and discharges throughout the day, but you just take those as they come. They really are not that bad to work through, and sometimes they can be at an inconvenient time for you, but just remember why you are a nurse, and remember you are going to get through the day. Nursing is a 24-hour job. No, you don't want to pass some things to night shift to do, or you don't want to pass some things for day shift to do. But you do need to remember it is a 24-hour job. So if there is something the prior shift did not get done and now you need to do it, don't give them a hassle about it. It is what it is. It's the nature of this job. We are living human beings, and things don't work out how we always want them to work out. So you just go with the flow. You have to be very, very flexible in nursing, and you you will get through your days. So thank you all so much for watching my video on how to organize your day. If you have any questions, please comment below and I would be so happy to respond. You can email me at nursekatherinehere@gmail.com. You can find me on Instagram, Nurse Catherine here. Message me on there. Whatever way you want to get in contact with me, I would be more than happy to help. Please subscribe to my channel and be on a lookout for Friday's video. See ya.